genetic disease, okay? It's inherited, it's passed on from parents to their children, okay? It's a disease that affects a component of the blood called the red blood cells. Okay? These red blood cells are responsible for transferring oxygen, which is taken to all the tissues in all parts of the body. So sickle cell disease is a multi-systemic disease. It affects all the systems of the body. Okay, so normally there's the red blood cells. They have what we call the hemoglobin, which is responsible for carrying that oxygen and is responsible for the red pigmentation of the blood. That's why you see the blood red, because of those red blood cells that are there. Okay, so in sickle cell disease, there's an abnormality in the genetic coding of the hemoglobin itself. Okay, so when this the sickle cell disease is not just hemoglobin SS that we all know about. There are other forms. It's a spectrum of this diseases. We have a person that has sickle cell disease has an abnormal an S hemoglobin and other forms of hemoglobin, which could be heterozygous. That's, he can have an S2S, or he can have an S and a C, or he can have an S and a D. He can have an S with beta thalassemia. There are a wide range of disorders, but most commonly what we know here is the hemoglobin SS, which we refer to as the sickle cell anemia. Okay, the sickle cell anemia is very, very common, especially in this part of the world. It's said that it's the largest burden in the world is in West Africa, and some studies have found that Nigeria has also the highest burden in the world. Okay, so that's why this lecture is very, very important, because we want to create awareness so that we would like to try and prevent the occurrence of this disease. Okay, so as I said, it affects the red blood cells, the hemoglobin aspect of the red blood cells. These red blood cells, they have a specific shape, which we call the discoid. It has a discoid shape. This discoid shape helps it to maneuver and pass through the smallest of blood vessels. Okay, blood vessels, how will I explain this? Okay, blood vessels are like pipes through which the blood flows to all tissues in the body. So these red blood cells have a specific shape that allows them to pass through these blood vessels. But in the case of sickle cell disease, the shape of the red blood cells becomes altered to give a sickle appearance. We know what a sickle looks like, right? We all know what a sickle looks like. You know what we used to harvest rice, or what the layman, the Hausa people call lauje. We know it. So that's what instead of the red cell appearing discoid, it becomes like sickled in shape, and then it becomes rigid. It's not flexible, so it doesn't pass through these blood vessels. So the rigidity of the sickle cell causes obstruction. So the blood is not able to pass through that vessel and get to the tissue that it's supposed to get to. So those tissues are deprived of oxygen, and then it causes pain and swelling. Okay, so that's the classical presentation of most sickle cell disease individuals. They come with pain, swelling, with heart attacks and all that, depending on where these problems occur. Okay, the myths about that are common for sickle cell disease is that some people would say that if a couple that get married and they have the genotype, one has the AS genotype, the A is the normal hemoglobin, and then if a couple one has a hemoglobin AS and the other has hemoglobin AS, the myth that I encounter mostly in my medical practice is that people believe that you can have one of your children being a sickler. You can have maybe two. If you have 8, maybe after 3 you can have one, maybe after, but it's not like that. the chances are for a couple who have both genotype AS, the chances of having a sickle child is 25% for each pregnancy. It's not for the number of children. So a couple can have all their children being sicklers. Okay, I hope we get this notion. And there's also a myth that says that mostly only individuals of African descent have sickle cell disease. Well, this has changed because of migration, because of intermarriages and all that. You can have as far back as your great grandparents having the S gene, and then you can have this S gene, and then you can marry anywhere, and then the S gene will now become dominant, and then you can have children with the sickle cell disease. Okay, the clinical features, from mostly it starts appearing from the 6th month of life. After a child is born, there's what we call the fetal hemoglobin, which confers a form of immunity to the children. So they don't present with those features of pain and swelling and other forms of clinical manifestation of sickle cell disease. But from 6 months of life, that fetal hemoglobin starts to decrease, and the cells start to sickle more, because the hemoglobin S will start to show, and then the child will start having painful hand and foot swelling. Those are the first symptoms that a child will present with from the 6th month of life. So they have what we call painful dactylitis. They have swellings in the hands and feet that are painful. Okay, so those are from when they start getting older. They can have painful crisis. They can have pain in their joints, in the vertebrae. They can have abdominal pain when the vessels of the abdomen tends to get blocked and you have ischemia. You can have acute chest syndrome. They come with chest pain when the muscles of the lung, when the vessels of the lungs become affected. They can come with strokes. Okay, they can come with what we call prepism, which can affect their fertility at the end of the day. There's a wide range of problems that can occur with sickle cell disease. So in essence, what we are saying is sickle cell disease is an inherited disease that is not a short-term disease. It's not something that can occur and it will be treated and it will go away. It's a lifetime thing. Once a person has been diagnosed with it, it's a lifetime thing. What can be done is to manage it, okay, and to try and educate the parents, okay, and the individual himself, depending on whether it's an adult or a child, on ways to prevent the occurrence of sickle cell disease, sickle cell crisis. Okay, so about sickle cell crisis, the bottom line about it is what I explained earlier to you, that is because of this blockade by those rigid sickle cells that the individuals develop those pains. Okay, so there are triggers for the formation of those sickled cells. We have triggers such as extremes of temperature, like when there's excessive cold or there's excessive heat, or if the individual is dehydrated, he doesn't have enough water in the body, or infections such as malaria, such as other urinary tract infections, other infections. Okay, those are the things that can trigger the crisis that we have in sickle cell disease. As a way of prevention of sickle cell disease, as we all know that we are tending towards preventive medicine now. Everything that people are trying to do is to prevent the occurrence of diseases before they even occur. Sometimes you tend to modify the risk factors before they even appear. Sometimes when they appear, you try to dampen them. Sometimes you treat and then prevent complications as well. So for sickle cell disease, what we opt for is we opt for premarital counseling, trying to educate the couple on the importance of genetic screening and prevention of sickle cell disease in these individuals. Well, for the treatment, that one is when you come to our, it's mostly hospital-based. When they appear with those symptoms, present to the hospital so that the individuals can be evaluated properly, and then the medical professionals will take care of the rest. Okay, thank you very much. I hope you have a lot of questions as regards this.
Please, I takbir.
I would like to ask Dr.
We welcome Dr. Muhammad Baba Sudani, the Chief Imam of ASD Central Mosque. So Malan made a lot of sacrifice to be here with us, because as I said today, I learned that Malan is in Abuja, but he still make that sacrifice to join us this morning. May Allah subhanahu wa ta'ala reward him abundantly. So inshallah, Malan, you are welcome. The first presenter, Dr. Zainab, has given us the clinical background of the sickle cell. So we are with the Islamic perspective regarding the sickle cell disease from you. So inshallah, we allow Malan to give us his talk. So afterwards, then we now collate all the questions, then the two presenters can now give us answer to them. So inshallah. Assalamu alaikum.